WRAL's health team. Coverage you can count on.
It's a delicate medical issue to talk about, but it affects 60% of adults at some time in their lives. It can literally be a pain in the backside. WRAL's health team, Dr. Alan Mask, is here to explain. Dr. Mask?
Deborah, we're talking about hemorrhoids. It's simply a protruding blood vessel. There are 6 of them where blood gets trapped. Now, patients often try to suffer through the pain because standard procedures can also hurt with a long recovery. A new procedure offers a solution with very little discomfort.
I can fix something that really bothers people that they suffer with and not hurt them too badly.
General surgeon Dr. David Zala says a new procedure known as THD doesn't just treat the symptoms of hemorrhoid pain, it cures the problem.
Think about your hemorrhoid as a balloon, a water balloon. The faucet is filling the balloon up, and that's why you get the hemorrhoids. What the THD procedure does is identify where the faucet is and turns it off.
The patient is typically asleep during the procedure. A special device goes to the top of the artery feeding the hemorrhoid and using sutures ties a knot in it.
Here's the knot that cuts off the faucet, that turns off the blood flow to the plexus. And those other stitches were pulling the hemorrhoid back inside.
So, Dr. Mask, what are the treatment options for hemorrhoids?
Well, the first rule, Deborah, is don't overtreat, okay? We're talking about hemorrhoids that can be classified into 4 grades. There's grade 1, there's just a bit of bleeding and itching, to grade 4, where they protrude out and stay there all the time. Now, for simple cases, I recommend just some Anusol HC rectal cream that contains a steroid. That plus a hot bath will go a long way. Doctors can also do something called sclerotherapy, where the hemorrhoids are injected with a saline solution to clot them. There's also a procedure called banding, where they can be tied off with rubber bands. Now, for more complicated cases, there are surgical options like stapling, where the hemorrhoids are removed, or this new THD procedure.
Is there any way to prevent hemorrhoids?
Well, you can prevent them. First, you want to do all you can do to prevent constipation. You want to get lots of fiber in your diet, make sure not to strain, and be aware of the fact that they're more common in pregnancy and in older people. Now, if you have rectal bleeding, don't assume that it's coming from hemorrhoids. There may be a more serious problem like cancer that will require colonoscopy and further evaluation. It's so important. Now, for more information about hemorrhoids or this new THD procedure, look for a web link on WRAL.com along with this story.
Thank you for talking about this very touchy subject.
It's important to talk about.
It is.
Though.
Thanks, Dr. Mask.
You bet.